Shared decision-making is a collaborative process where patients and their healthcare providers work together to make decisions, and this is important for veterans living with MS. I'm Emily, and I'll be your moderator for Ask an MS Expert Veterans Program today. I'm a proud Air Force wife, dog mom, certified personal trainer who teaches adaptive fitness classes for the MS community, and I've been living with MS for over 19 years. I'm currently located at Scott Air Force Base. Today, I'll be asking our expert the questions you want answered on topics impacting veterans affected by MS. MS navigators are here throughout the live program, answering questions and providing resources in the comments. I'd like to acknowledge and thank today's national sponsor, Lockheed Martin. Support from MS partners, community partners helps the society reach its goals, including providing up-to-date information and support through programs like Ask an MS Expert Veterans Program. Having a voice in your own healthcare decisions ensures that your goals, values, and preferences are being met. Shared decision-making is important for people living with MS who typically have providers and complex issues that require more specialized care. Joining us to talk about shared decision-making and its role at the VA is Anna Barker, a health communication researcher at the Center for Health Optimization and Implementation Research with the VA healthcare system in Bedford, Massachusetts. Welcome, Anna. Thanks for being with us today.
Thanks, Emily. I'm very happy to be here.
Awesome. So shared decision-making in healthcare is a partnership between the provider and the patient. So can you tell us what shared decision-making is?
Sure. So shared decision-making is a very special kind of clinical conversation where the doctor and the patient work in partnership to arrive at the best care for the individual patient. So the doctor contributes their clinical expertise and patients share their values, goals, and preferences. Then they deliberate or talk it over and arrive at a decision together.
Love that. So can you tell us why shared decision-making is important to a veteran living with MS?
Right. Well, with MS, there are just so many decisions to make to manage your care. And in many cases, the benefits and the potential harms are equal. So there really isn't a clear answer. And shared decision making is especially needed in those situations because you need the clinical information from the provider, but the provider also needs to know what matters most to you. So both of those inputs are equally important to reach the right decision.
Absolutely. So how is the relationship for somebody who has MS versus the traditional doctor-patient relationship? What is the difference between those two?
Yeah. Well, I think when we say traditional care, maybe we're talking more about acute care. So you go to the doctor with a broken arm, you don't want to have a shared decision-making conversation about what to do next, right?
Mm-hmm.
You want to
Yeah.
get an x-ray, you want to cast, and you want to be out of there with your arm treated. But with MS, it's more of a chronic condition, so you need specialized care and multiple providers. That's really a lot to manage over a long period of time, and we're not going to have the same answer for everyone.
Sure. Yeah. MS is so complex and it kind of changes over time. So that definitely makes sense. So the VA encourages shared decision making through the concept of whole health. So does the VA have any specific policies or practices in place to support shared decision making?
Right. Yeah. Well, whole health is very important and related to shared decision making because part of whole health is starting every conversation with our veterans with the question, what matters to you, instead of asking, what's the matter with you, which is the sort of old, outdated way of approaching care.
Sure.
And with whole health, also, you can work to identify your own values and goals and then create a personal health plan that you can then share with your healthcare team. And we even have an empowerment course called Taking Charge of My Life and Health. And at some sites, you can meet with a whole health coach.
Oh, that's awesome. Kind of empowering the patient. That sounds like that's kind of what it's about.
Right, right.
So we heard from Jonathan, who says he doesn't know enough about MS disease modifying medications and their risks to make the decision about which medication he should take. So, how can healthcare providers at the VA help their patients feel more confident in participating equally in making these decisions?
Yeah. Well, I would tell Jonathan that he's an expert in his own body and he knows his own values and preferences. So he's the only one who can contribute that information to the decision-making process.
Mm.
Jonathan's VA provider can share information about medications, but we need both sides of the conversation so that they can make the decision together about what medication Jonathan should take.
Yeah. Yeah. There's so many different like lifestyle factors and things about our lives that would really help with that decision making process.
Exactly.
Yeah.
Yeah.
So Sheila, she's a little weary about shared decision making because she doesn't want to seem like as a problem patient. So why is it important for Sheila to have a say in her care?
Well, Sheila is not alone.
Mm-hmm.
Um, Many patients that we talk with say things like, I don't want to rock the boat, you know.
Mm-hmm.
And as women, especially, we're trained to be polite, you know, and polite usually means quiet. But if you don't leave the appointment with the information that you need and feeling like your concerns are heard, well, often what happens is that patients decide on their own not to follow up. So, not to get a screening, not to fill a prescription or take a medication. So, Sheila's doctor really wants to hear her questions so that Sheila can make an informed decision about her care and then follow through.
Yeah, that's so important. This question from Connor, I think, is so relevant. So Connor was raised in a military family and is now a veteran himself. So military hierarchy is ingrained in him. He sees the doctor as an authority figure and worries that voicing his opinion would be disrespectful. So how can Connor respectfully incorporate shared decision making?
Yes, yes, I hear that often. Sir, yes, sir, right?
Mm-hmm.
And Connor might also be experiencing anxiety if being around doctors makes him nervous. But hopefully, our conversation today can help reassure Connor that doctors want and need to hear his opinion. Um,
Yeah.
he might also talk with his friends about what they say at a doctor's visit or write down his concerns so he's comfortable with that and feels prepared in advance. And he can even practice what he wants to say on the way to his appointment.
Yeah.
And then I want to share another. This I do this. So if mild anxiety becomes a problem for Connor, he could spend the time that he's waiting for the doctor to arrive. You know, that time when you're in the exam room and you're waiting and sometimes waiting and waiting. Uh,
Mm-hmm.
you can use that time to, you know, practice some deep breathing or some other calming techniques.
Yeah. Well, like you mentioned earlier, like Connor, you are an expert on what your lived
Exactly.
experience is, and I think that that's an important aspect of empowering patients to be like, you're the expert in this, in how you are feeling.
Right. Right.
So now, if the healthcare provider isn't accustomed to including their patient in treatment decisions, how can a veteran living with MS advocate for themselves to be a part of that conversation?
Yeah. Um, so I think a really good just technique to use it is kind of simple is to start the appointment with some sort of a message like, hey, I just want to make sure that we get a chance to talk about X, you know, and
Mm-hmm.
that could be a symptom that you have or a reaction to a medication that you're concerned about, but it could also be something outside of that, something from your work life or some area of your life where MS is making it, you know, you want to be your best self. So, not limiting it to the sort of biomedical conversations that we usually have with doctors.
Mm-hmm.
And then you can also, so there's agenda setting at the beginning of the appointment, but also look for those social cues that we always have in conversations, right? So we get trained when someone says, "How are you?" We say, "I'm fine. How are you?"
Mhm.
But when the doctor says, "How are you? How's it going?" Don't just say, "I'm fine." Use that as an opportunity to say, "I do have one concern," or, at the top of my list is whatever it is.
Mhm.
And just know that being proactive in the conversation in that way, it's a way that you're telling the provider, I'm not just here waiting to be told what to do.
Mm. Yeah, kind of taking charge of how the direction of the appointment, how you want it to go, kind of.
Yeah, exactly. Subtly, politely,
Yeah,
but nevertheless.
so good. So there are so many different topics that a patient and their healthcare provider might discuss in an appointment. And so with so many medications to choose from, how does a patient and their healthcare provider decide which is best? What would a conversation rooted in shared decision making look like?
Right. So I know when I'm listening to these conversations, I know that I'm hearing shared decision making when I hear patients taking that opportunity to share their values and goals. So if I hear something like, "I love to garden, I don't want to give that up," or Emily, you mentioned you're a dog mom, I want to make sure that I can take care of my dogs.
Mm-hmm.
Uh, that's important information for the doctor.
Yeah.
Doctors are trained to solve problems, and many times that's exactly what we need. But
Mm.
on the other hand, it's just so much more positive and it's helpful to be working towards a goal instead of just trying to keep your symptoms at bay.
Absolutely. Quality of life for sure. Yeah. So we heard from Derek, who said that his doctor's appointments seem to fly by and he doesn't have enough time to discuss everything with his doctor. So, what advice do you have for Derek to help him make the most of his time?
Yeah. Well, I mentioned writing things down in advance. That helps you keep everything straight, but it also is efficient.
Mm-hmm.
And, come to that appointment prepared to share and to share what you're looking for. And again, set that agenda at the beginning of the appointment. Um, Appointments, they do fly by. There
Mm-hmm.
isn't, I wish I had a magic wand for that. But there are a few things that you can do.
Yeah, I know I have some cognitive challenges because of my MS, and so yeah, writing things down is helpful so I don't forget. And you had mentioned something about like what's important to you, so maybe remembering what are the things that are important in this discussion that you want to address or something.
Yeah,
So,
yeah. And
yeah.
that personal health plan that Whole Health has is a really good way for people to sit down. Sometimes you don't know what your values and goals are until you give it a little bit of thought
Mhm.
ahead of time. And it's a very good exercise, good thing to do.
Yeah. So when it comes to medication side effects, they can range from mild to annoying to uncomfortable and even problematic. So how long should someone tolerate side effects and to what degree before they consider switching medications?
I can't really answer that question about when to switch. For each person, there's just so many different variables.
Mm-hmm.
But what I can talk about is when to talk about side effects with your provider,
Mm-hmm.
um, because the answer to that is right away, or as soon as you feel like side effects are causing you concern. So really, don't wait to have that conversation.
Yeah.
And patients can ask, what side effects should I watch for when
Mm-hmm.
talking about new prescriptions, and then you have that information as you try a new treatment. Um,
Absolutely.
yeah, I can also mention that we have a patient portal called My Healthy Vet. I don't know if you've heard of that. So you can use that if you sign up for it. You can use that to send secure messages to your healthcare team. So that's a good way to communicate, especially if you're feeling shy in the appointment or you've forgotten something.
Mm-hmm.
You can just write it down and take the time and look it over, make sure that that's what you want to say. Um,
Yeah,
but I do, thinking about this particular question, I want to make sure too that I say call 911, right? If
mhm,
you're, it's, if you have an allergic reaction or you're having trouble breathing, uh,
sure.
that's definitely not a time to wait.
Right. Yeah. Or even just kind of tracking or logging like whatever some side effects may be. That way you have something to share with your doctors of like when it started happening or whatever the case may be.
Right. That's a great idea. They're going to ask.
Yeah.
So, yeah. Uh-huh.
Okay, so Donna is having some uncomfortable side effects, but her doctor seems to brush off her concerns, saying that all MS medications have side effects and that she should just deal with it rather than being dramatic. So, what advice do you have for Donna when she feels like she's experiencing medical gaslighting?
Well, that's a bad doctor. That's what I have to say to that. So Donna should contact her patient advocate.
Mm,
They are trained. There's one at every site. They have a formal process. They will hear your concerns and they have a protocol for making sure that it's taken care of. So that's definitely what I would tell her to do, because doctors should not be saying things to you like, don't be so dramatic, or,
mhm.
what was the other thing that she said?
Just deal
That,
with it.
yeah, just deal with it. Yes,
Mm,
right. Don't do that. Uh,
yeah.
but I do want to say that I don't think that most doctors are intentionally dismissing their patients' concerns.
Mm,
They're human, they carry their own baggage.
sure.
And some of that baggage comes from their training. They're
Mm,
rewarded for memorizing things and calling up a huge amount of medical data for having all of the answers. And we want that from our doctors. But sometimes I think it feels like their communication skills aren't emphasized enough by the system.
yeah. Well, it's good
Yeah,
to know that there are patient advocates out there who can help guide
right.
patients in doing.
Yeah, yeah. I'm sorry that happened to Donna.
Yeah. So Lionel has cognitive challenges from his MS that he manages with healthy lifestyle and medication, but he does feel like there's a bias against him participating in shared decision making. What can Lionel do?
I think it's okay for Lionel to be fairly direct. So he can look for an opportunity to say something to his provider, like, I'm having difficulty with my speech or memory or concentration or whatever it is. I'm having difficulty right now, but I understand everything. So
Mm,
please explain to me what I need to know.
yeah.
And people, I think, in that situation sometimes bring a friend or a loved one to an appointment with them, which
Hmm.
is a good idea. They can, hear and ask follow up questions, and they can just be there for moral support. But if you do that, I would suggest that you ask the person in advance to look for times to redirect the conversation to you.
Mm,
So I did that, at pediatrician appointments with the kids when the kids were growing up. The doctor would ask me, how's it going with Sophie at school? And instead of answering his question, I would turn to Sophie and say, Sophie, how is it going for you at school? And give her the chance to answer for herself.
yeah. That's such a good suggestion. Are there concerns about people with cognitive challenges helping make decisions?
Well, thinking again about Lionel, so he might have trouble with complexity and, sifting through the data, but just a reminder that he knows his values.
Mhm.
So if he can share that, share what his priorities are, what his values for his health are, then the provider can help with the treatment that helps him to reach those goals. So you can still think in advance about what is a realistic goal and ask
Mhm.
the provider for help with that.
I feel like you shared some tips, but like issues like Lionel's with cognition, it's common for people with MS. So how can someone proactively prevent the paternalistic approach from their healthcare team when cognition is a factor.
Right, right. I want to say that it's not on Lionel or any other veteran to change their healthcare team's behavior.
Mm.
Providers really need to continue to work to check their biases at the door.
Mm.
We take implicit bias training, which helps us to be mindful of those things that we're maybe doing unconsciously.
Yeah.
That's a good thing. It's also nice when, doctors do things like coming out from behind their computers and talking with us. Uh,
Yes.
we don't have control over all of that, and we shouldn't be expected to fix things. We have enough going on, right? Taking care of ourselves.
Mm-hmm.
But veterans, as we've talked about, you can look for opportunities to share your own expertise. You know yourself best,
Mm-hmm.
and really go ahead and speak up.
Yeah. Love that. All right. So you've kind of mentioned a couple of resources. So let's talk about resources and support for veterans living with MS. So are there any resources to help a veteran introduce shared decision making into their healthcare appointments?
Yeah, sure, sure. Yes, there are resources. So I worked with a group of veteran co-designers. We collaborated on creating a book called You Are the Key, a little booklet. And that includes a quiz. And there's lots of information in it, but there's a quiz that can help you think about the kind of patient you are or the kind of patient that you want to be. It's just a little opportunity for reflection. And I can share that link. Maybe you can drop it in the chat box so people can take a look at that. It's hard to find just by Googling it, so I'll share the link. And then our whole health people, the VA's whole health website, which you can find just by Googling VA whole health. They have so many resources. So you can look there for the personal health inventory that we talked a little bit about, where you create a personal health plan and you can share that with your team. They also have a place where you can go to find a whole health point of contact at your site.
Okay.
And lots of videos and stories from veterans, information about how complementary and integrative health can help you. And VA provides a lot of different therapies that way, yoga, acupuncture, different things like that. And then lastly, I would say just Google MS and shared decision making, and you'll find a lot of resources beyond those just for veterans in VA.
Great. So important to empower patients to know that they get to be part of these conversations. They don't have to be just told what to do. I think that's
Exactly.
so important.
Yeah.
Well, you've shared some really helpful insights and shared about shared decision making at the VA. So I know we talked about a lot of things. So what would you say is like the top takeaway that you would like our viewers to remember and to use?
Right. I appreciate being asked that. So I hope that veterans will leave our conversation with the knowledge that their values, their goals, their preferences are an important part of good medical care.
Mm-hmm.
And going along with that, that shared decision making, it's really just another way of saying that you play a key role in conversations with your healthcare team when making decisions related to your care. You are your own best expert. And I would say there are three things that you can do to be ready for that role. So you can do it by being prepared in advance. As we said, write down those questions and think about realistic goals that you can talk with your doctor about wanting to achieve. And you can be ready by giving yourself permission to speak up and know that you can expect to be heard. And then the last thing is just investigating those resources, like the whole health approach to care resources that I mentioned.
Great. I love it. I love it. Well, thank you so much for being with us today, Anna. We really appreciate it.
Thanks. I really enjoyed talking with you.
Today's program survey has now been posted in the chat for your feedback. Please take a minute and complete it to help us create programs and topics with you in mind. Please be sure to visit the Society's website for information and resources on MS, connection opportunities, and ways to get involved. You can also connect with an MS navigator to receive personalized support by phone, email, or through the Society's website by chat. The recording will be made available on the Society's website at nationalmssociety.org/MS Expert and on Facebook and YouTube. Well, thanks for joining Ask an MS Expert Veterans Program. We'll see you next time.